The critical role of emergency CT chest. CT chest play a vital role as diagnostic acute thoracic emergencies involving the lung, hearts, and major vessels. It provides rapid diagnosis, guides treatment, differentiate causes, trauma evaluation, improve outcome. A well-prepared technologist directly contributes a timely diagnosis and improve patient outcome. Technologist checklist for emergency chest. Patient preparation and screening, confirm patient identity, ask about allergies, a woman patient, ask pregnancy, and one of the most important thing in CT contrast, see the renal function, serum creatinine. Contrast IV line, good IV, secure IV line. Before the scan start, flush the IV line. Protocol selection, choose the correct study according to the doctor advice. Patient communication, explain the procedure to patient completely. Emergencies, readiness, crash card nearby, oxygen available, and now who to call. Emergency CT chest protocol. To the following protocols outline the essential scanning technique used for acute chest emergencies, ensuring accuracy, constraint, and patient safety. First, pulmonary embolism, aortic dissection, pneumothorax, hemothorax, pericardial effusion, chest trauma, mediastinal mass with compression. Emergency CT chest protocol. Understanding and correctly applying the specific protocol is paramount for accurate diagnosis in emergent situation. Pulmonary embolism. A blockage in the pulmonary arteries, often from a blood clot. CT protocol, CT pulmonary angiography, bolus tracking over main pulmonary artery. Technologist tips, ensure good IV access in a good vein. Inject contrast at 4 to 5 ml per second or according to IV. In pulmonary embolism, sometime machine don't pick the contrast because a patient movement. As a radiology technologist, हमारे eyes इतने sharp होने चाहिए कि जैसे pulmonary trunk में contrast आए और CT machine pick ना करे. उसी वक्त before the contrast out the pulmonary trunk, you can start scan. Aortic dissection. An aneurysm is defined as a localized abnormal dissection or bulging. CT aortogram, coverage chest and abdomen. Technologist tips, use ECG guided CT if available for ascending aorta. Prepare for possible multiple phase imaging. Pneumothorax, air in the pleural space collapsing the lungs. Use non-contrast, use lung window. Watch for shift of mediastinum. Oxygen support should be continued during scan. Hemothorax, blood or fluid in the pleural space, often post-trauma or surgery. Contrast enhanced CT chest, use soft tissues or lung window, note fluid level or location. If trauma is recent, ensure the contrast is used to detect active bleeding. Pericardial effusion tamponade, fluid in the pericardial sac compressing the heart. Contrast CT chest, CT cardiac, evaluate pericardial and heart chambers. Technologist tips, look for enlarged cardiac shadows and pericardial fat strip. If the patient shows sudden worsening, it may indicate cardiac tamponade, a medical emergency. Chest trauma, multiple injuries, post-blunt or penetrating chest trauma. CT chest trauma protocols, use MPR view, axial, coronal, sagittal. Look at the scout image for any ribs fracture of abnormal rib movement. Air tracking in mediastinum, suspect airway injuries. Mediastinal mass, tumor or lymphadenopathy, compressing vessel or airway. Contrast enhanced CT chest, include mediastinal lung window. Note if patient is struggling to breathe when supine, alert SVC syndrome. Contrast safety technologist checklist, check allergy history, ask about the past reaction to contrast any medication. Inform the radiologists, always get approval before injection. Pre-medication may be used for now allergic but Required stamps are not ideal in urgent scans. Use alternative non-CT contrast, MRI, ultrasound if contrast is unsafe. Be prepared. Keep emergency drugs, oxygen and crush card ready. Monitor the patient. Watch for any discomfort, rush or shortness of breath during after injection. This is the summary of all presentations. Take home message: when in doubt, call the radiologist. You are the eyes before their eyes. Thank you.